Who has the rights to deceased patient records? Determining who has rights to access a deceased patient's medical records can be a challenge for healthcare providers. Facilities who are unfamiliar with the law may err on the side of caution and deny requests for access to patients' medical records, or they may release medical records without proper verification. Personal representatives. Release of medical records becomes an issue when there is no personal representative appointed by the patient. The idea is to have the patient identify the personal representative during or right after the admission process. Proof and the courts. Sometimes healthcare providers are left with hard decisions of who is granted access to medical records. Records are granted to the requester once the requester can prove that they are legally entitled to the deceased patient medical records. Proving that someone is legally entitled to medical records of the deceased is not always easy. There may be disagreements between the patient, spouse, and family members. This is why it is a good idea to have the patient name their personal representative upon admission. However, it is not the healthcare professional's decision to grant or deny access to medical records. The requester or requesters should go to the courts to argue their case. What did HIPAA change? HIPAA did not change the law. HIPAA simply enforces the law that was already in place. The best thing a facility can do is learn the law. Using HIPAA as an excuse to deny or grant access to medical records is not enough. The facility and healthcare provider should understand the law and explain why the requester is denied access and how he or she can go about providing valid documentation for requesting medical records. Thank you.